expert right now in the top 3 things that you need to know at 10.
Okay, someone who does not spread fake news and someone who is, if anything, I know she is blunt and she does not sugarcoat anything. That is Dr. Angela Rasmussen, who joins us now. Hi, doctor.
Hi, Ursula. How are you?
Oh, just a little frustrated, as but that's so minor compared to what people are going through all around the world. So I'm not here to complain about that. But I want to, for people who don't know you, we've been talking to you for months and months and months, since pretty much the beginning of the pandemic. Can you give us basically your credentials?
Yeah, of course. I'm happy to. So I'm Angie Rasmussen. I'm a virologist. I have a PhD in microbiology and immunology from Columbia University that I got in 2009. I did my postdoc at the University of Washington, and I'm from Puyallup. I study emerging viruses, including SARS coronavirus 2. And currently, I am an associate professor at the University of Saskatchewan, working here at the Vaccine and Infectious Disease Organization, which is a research institute that focuses on developing vaccines for pandemic viruses.
Okay, and I'm sorry to make you do that, but there is such a distrust in people who are brought in as experts. And I want to say that this is a show where we don't have the answers. We don't have all the answers. And so we go to people like you, Dr. Rasmussen, for these answers. So if we could, let's talk about the whole booster shots thing. We're supposed to get a booster shot 8 months after our last dose. Why?
So this is a new recommendation that the CDC and the White House have put out. And I have to say, I don't completely agree with this recommendation. So this was based on several papers that have come out that have shown a decrease in vaccine effectiveness against breakthrough infections caused by Delta. And that sounds really scary to a lot of people because we just hear all this, Delta, oh my God, it's more contagious. People are in the hospital all the time. Kids are in the hospital. This is really bad. And without question, Delta is really bad. But I want to say, and I want to make this very clear, that the breakthrough infections you are hearing about are largely not associated with cases of severe COVID. When you look at vaccine effectiveness for hospitalization and death, the vaccines are actually pretty much holding up. They're really not decreased that much in terms of their effectiveness, protecting people who are vaccinated against severe disease. Now, there are a couple exceptions to this. It does look like some older people at 8 months or so after their last dose of vaccination, and these are people who are high risk anyways. This is not just older people. It's older people plus people who have comorbidities that put them at higher risk of COVID anyways, or severe COVID. So those people, as well as people who are immunocompromised, so people who've had an organ transplant, who are taking steroids for chronic inflammatory conditions, people who are potentially have advanced HIV, those people do need a third shot. And there's a lot of data really supporting that. But for most people, if you're already at lower risk of developing severe COVID, I don't actually think that the data does suggest that you need an actual booster shot. I'm glad that they're going to be available because I know a lot of people have been contacting me, asking me if they can get one. They're certainly not going to hurt. But people should know that the vaccines are still working against Delta for what they're really supposed to work against. And that is protecting people from ending up in the hospital or even worse, ending up in the morgue.
Dr. Rasmussen, the number of total cases in the United States, it rose nearly 18% over the last week. As a matter of fact, 1 in 5 ICUs throughout the U.S. has at least 95% of beds occupied. Now, that looks grim. Is this going to be a peak soon? I know that it peaked out over in the UK. What is it looking like here?
So what we're seeing here is that these surges you're talking about, you even said, G, they're in some places. Okay. So we, I think, unfortunately, are going to continue to see surges occurring at different times in different places. And that depends on a lot of different things. It depends on how much community transmission there is in each community. It also depends on, how much Delta variant is already there, because this is largely being driven by Delta. And it also will be related in large part to how many people are vaccinated and what other policies might be in place to reduce community transmission. So things like masks. As schools reopen, are those schools going to apply mitigation measures for those unvaccinated kids? When will vaccines actually be approved for kids under the age of 12? So this is a really complex, multivariate situation in which there's a number of different things that we need to consider when looking at any given community and thinking about when surges are going to occur. But one thing is for sure, in all of those ICUs that you just mentioned that have, that are filling up and that are full of people, that's still predominantly unvaccinated people. So we can change this from one community to the next by just focusing on the number of people who are unvaccinated and doing whatever it takes to either persuade them to get vaccinated or to make vaccines more accessible to them. Because not everybody who's unvaccinated is unvaccinated by choice. There's a lot of people who feel that they can't get a vaccine because they can't afford to take time off work if they were to have side effects. They can't get childcare. They can't get transportation to a vaccination site. So we really need to focus on getting those unvaccinated people vaccinated. We need to focus on the data showing whether or not it's safe to vaccinate children under the age of 12. And we need to focus on that because those are the people who are ending up in the hospital and getting sick overwhelmingly.
According to the CDC, rates of COVID-19 hospitalizations for children and adults under 50 have reached their highest levels since we've been dealing with this pandemic. Why?
So this is really a numbers game, and this is why Delta is so concerning. Delta is more contagious. It's more transmissible. That means that people who didn't get one of the other variants, but who are also unvaccinated, are more likely to get Delta, and Delta is going to cause more infections just because it's easier to spread within people who are unvaccinated. People over the age of 65, people over the age of 50, because the vaccines were first rolled out to them and because those people are the highest risk based on age, a lot of those people are vaccinated. We do have a lot of older people who have been completely vaccinated. Where we have less uptake is with people under the age of 40 or 50 by choice or access, as well as children under the age of 12. So those are all unvaccinated people. That's who the Delta variant is going to be most likely to spread among. And if more people in that group are being infected, you're just going to, by virtue of simple math, see more people ending up in the hospital.
Dr. Rasmussen, one of the things that I see so often is this question of, well, if you get vaccinated, first of all, if you get vaccinated, why do you need to wear a mask? And if you get vaccinated, and there are so many breakthrough cases, and I think in some areas it was up to 20%, does that mean that the vaccine is just not efficient? It's not worth anything?
No, that's not at all what that means. So first of all, I will say that no vaccine is 100% effective. It just is not the case for any vaccine, no matter how good it is. Not every vaccine also produces completely sterilizing immunity, meaning that these vaccines aren't going to protect everybody from getting infected in the first place. What they do protect very well against, but again, not 100%, is disease. So if you get infected by COVID and you have zero symptoms, does it even really matter? From a public health perspective, it doesn't matter as much. And this is not to discount things like long COVID. That is very much a problem. Obviously, it's preferable to not get infected at once. But there is tremendous public health benefit in getting vaccinated because, as I said before, it will keep you out of the hospital or be more likely to keep you out of the hospital. And at the community level, it does make the entire population less susceptible to getting infected. When enough people are immunized, the virus is going to have a very, very difficult time finding a new host to jump into that's going to be hospitable to it. And this is the concept of herd immunity that we've been hearing about a lot. But until we get to herd immunity and until we drive down prevalence in the community, we're going to continue to see breakthrough infections. And because these vaccines aren't 100% effective, we will see more breakthrough infections in more vaccinated people as more people get vaccinated, because that's the majority of the people. But one thing, again, that I want to emphasize is that we hear about all this breakthrough infection, but what people need to know is the people who are really, really sick are mostly unvaccinated people. That was true in the UK. That's true in the US. That's true here in Canada. That's true really everywhere that has access to these vaccines. The vaccines are still very, very beneficial. They will still most likely save your life. And if you get a breakthrough infection, one thing you can do to avoid that is to wear a mask and to continue to take other precautions. Maybe don't go to that super crowded bar and hang out for hours, that super crowded restaurant that's poorly ventilated. Maybe continue to make some choices that, are kind of annoying, but will reduce your exposure risk to get overall prevalence down. Because once that happens, prevalence goes down, immunization continues to go up, we're going to see a lot less virus spreading. There will be fewer breakthrough infections, and importantly, less risk of somebody who is vaccinated passing that virus along to somebody they care about who is unvaccinated. That's what we really need to worry about with most of these breakthrough infections.
Okay, I have a question from one of our listeners from 253. If tracking transmission is important, why is the CDC only tracking breakthroughs that result in death and hospitalizations? And also, can breakthrough cases create COVID variants?
Yeah, so these are two really great questions. The first question about the CDC deciding not to track breakthrough infections unless they're severe enough to require hospitalization is something that I and many of my colleagues don't completely agree with. I think that it's really a lost opportunity to collect this type of data. And I think the reason why the CDC is doing that is because there are a number of challenges with getting states to report that data and to compile it all in one place. So I think it may be that they're just focusing more on other things, and they do have finite resources. So they've decided not to track cases that they don't see as large of a priority to public health as, people who are getting severely ill and who are unvaccinated. In that sense, I understand it because it's not like they're getting no data about this. They do have a number of different patient cohorts involved in various studies where they are looking at the rate of breakthrough infection. They're just not looking at it nationwide. But I agree completely that they should be tracking this. Now, can you remind me of the second question?
Yeah. Can breakthrough cases create COVID variants?
Oh, yes. Yes. This is a great question. And this is one I get all the time. So theoretically, they could, because every time the virus replicates, it has the chance to acquire mutations, and every mutation is essentially an evolutionary lottery ticket for the virus. If that mutation happens to be in a part of the virus's genome that gives it some kind of advantage, that's basically a variant of interest or a variant of concern. Now, have we seen variants of concern emerging from vaccinated people or breakthrough cases? We haven't. And if you look at Delta emerged after the spring surge in India, where the vaccination rate overall was very, very low. So the variants that we've seen so far, including Delta, have all emerged from uncontrolled transmission in unvaccinated populations. And that's a good sign. But I will add that as a virologist and as somebody who, thinks about the immune system all the time, this is not like evolving antibiotic resistance. The immune system is incredibly complex. You can think of it as like an army almost, where there's going to be different units that do different things to protect you. Some of those things, like neutralizing antibodies, will protect you against infection. Some of those things, like T cells, will protect you from disease and clear infections. And there's a number of different sort of specialized parts of the immune system that carry this out. It's probably not possible for a virus to evolve its way around all of those different mechanisms that the immune system has to protect us. So do I think we'll ever see completely vaccine-resistant variants emerge? I think it's really, really doubtful.
Oh, I'm glad to hear that. That is the voice of Dr. Angela Rasmussen as she joins the Gee Ursula Show. One last question. We got about a minute. And here, Ursula and I, we talk about the just absolute non-communication between Seattle City Council, the mayor, police chief, all of it. It's crazy. Sometimes I feel like the CDC and virologists, sometimes they have different messages as well. Has the information sometime coming out by the CDC kind of hurt some of this? Oh,
yeah, I think absolutely. I mean, I think that, I feel really empathetic to the people who are at the CDC. Now, most of the people think that the CDC is like the CDC director and then a couple of other people, but actually most of the people at the CDC are career public servants who've been working there for their entire careers or for decades or years. They are not involved in the messaging in large part. That is usually done by the CDC director and the more public-facing side of the CDC, who are political appointees, which is why we're now seeing such a different strategy with the CDC than we were during the Trump administration, because there's different people in charge and they have different priorities. But I think one thing that happened during 2020 was that the CDC was largely undercut by other parts of the Trump administration. And so people really did lose a lot of trust in the CDC. And definitely their reputation took a hit in the scientific community. Now, with Rochelle Walensky, I think a lot of my colleagues and myself have been somewhat disappointed by the convoluted messaging, especially the decision to recommend that people who are vaccinated don't need to wear masks anywhere. I think a lot of us felt that was really a one-size-fits-all solution to a much more complex problem. And then when the recommendations changed again, saying that actually you should wear a mask because of these breakthrough infections, people were a lot less likely to listen. So I think a lot of the decisions are being made by career scientists and public health professionals who are excellent. But I think the way that they're being communicated is really confusing for a lot of people, and I do think it has complicated the situation.
Thank you, Dr. Rasmussen. We appreciate your time. We'll talk soon. Hey, coming up next,